This is the Network for Continuing Medical Education, supported by Roche Laboratories.
Irritating, disturbing, hard to ignore. Insomnia, often a symptom associated with a bigger problem that may require the therapeutic intervention of Dalmane, flurazepam hydrochloride Roche. On the average, patients fall asleep within 17 minutes, experience fewer nighttime awakenings, and benefit from significantly increased total sleep time with Dalmane. Dalmane is compatible with chronic warfarin therapy and does not interfere with many common laboratory tests. Side effects are minimal, and studies have shown that there is no worsening of insomnia upon discontinuation. Patients taking a Schedule IV controlled substance such as Dalmane should be cautioned against concomitant use of alcohol or other CNS agents. Dalmane, the standard of hypnotic efficacy.
Modern medical rehabilitation programs offer new hope through improved exercise regimens, advanced orthotics and prosthetics, and remarkable individually designed devices that can restore confidence as well as mobility. Because mobility is the all-important goal in the rehabilitative process, Valium can be a valuable addition to your treatment programs. It is indicated in spasticity due to upper motor neuron disorders and in skeletal muscle spasm due to local pathology. Unlike cyclobenzaprine, the tricyclic muscle relaxant, Valium has been used in cardiovascular patients, in patients with hypothyroidism, and in children more than 6 months old. Side effects are rare and usually limited to drowsiness, fatigue, or ataxia. So when trauma and skeletal muscle spasm inhibit mobility, add Valium to your program.
In other parts of the world, England, France, the Netherlands, Spain, physicians have prescribed a loop diuretic that only recently has become available in the United States. Now, Roche introduces Bumex, bumetanide Roche. Bumex offers the advantage of consistently high GI absorption, assuring a predictable, efficient response. Diuresis starts within minutes and is essentially completed in 4 hours. Your congestive heart failure patients can have days of uninterrupted activities or nights of uninterrupted sleep. Bumex, bumetanide Roche, is contraindicated in anuria, patients with marked increase in BUN, states of severe electrolyte depletion, and patients hypersensitive to the drug. Bumex 0.5 milligram and 1 milligram scored tablets, and Bumex injection in 2 milliliter ampules. Bumex, the efficient loop diuretic. See cassette case for complete product information.
For the past 40 years, a variety of therapies have been used in the treatment of acne. But severe cystic acne, as you know, has generally resisted treatment until now. Roche Laboratories, a pioneer in retinoid research, is proud to introduce Accutane, isotretinoin Roche, the first oral retinoid for the treatment of severe recalcitrant cystic acne and a milestone in dermatology. With Accutane, for the first time, many refractory cystic acne patients can look forward to prolonged remission of disease. Here's why. Although we don't know its exact mechanism of action, we do know that Accutane has a marked temporary inhibitory effect on sebaceous gland activity. Biopsy specimens from treated patients show sharp decreases in the size of pilosebaceous cysts and inhibition of sebum formation during therapy. Clinical studies confirm the fact that patients on Accutane therapy produce less sebum as treatment progresses. Clinically, there are parallel decreases in the number and size of the nodulocystic lesions. Interestingly, remission in some patients continues even after sebum production returns to normal. Many patients need only a single 4 to 5 month course of therapy to achieve prolonged remission. But if a second course seems indicated, give the patient a drug-free interval for at least 8 weeks, because experience has shown that patients continue to improve after Accutane is discontinued. As might be expected, side effects with Accutane tend generally to be mucocutaneous, with cheilitis occurring in about 90% of patients. Other common reactions in cystic acne patients include conjunctivitis, pruritus and dryness of the skin and nasal mucosa. Mild to moderate musculoskeletal symptoms may also occur. For discussion of all other side effects associated with Accutane, please see your package insert. Of particular importance to clinicians, since oral retinoids are potentially teratogenic, patients who are pregnant or intend to become pregnant while undergoing treatment should not receive Accutane. Women of childbearing potential should use effective contraception throughout therapy and for 1 month thereafter or until a normal post-treatment menstrual period occurs. For patients with severe recalcitrant cystic acne, Accutane, isotretinoin, and Roche may be a turning point in therapy, holding the promise of prolonged remission for some patients. New Accutane 10 milligram and 40 milligram capsules from Roche, world leader in retinoid research. Before prescribing, please see complete product information in the nearby cassette.
The compromised host may be a patient who has abnormal neutrophil chemotactic activity. New evidence shows that Bactrim, trimethoprim, and sulfamethoxazole Roche enhances neutrophil chemotaxis in vitro. When placed in a medium with a chemotactic factor, neutrophils from a patient with a chemotactic defect do not migrate in large numbers toward the chemoattractant. But after 5 days treatment with Bactrim at a standard dosage, neutrophils from the same patient migrated in increased numbers toward the chemotactic factor. The clinical significance of this finding has not been determined. Bactrim IV infusion, aggressive antimicrobial therapy for pneumocystis carinii pneumonitis, severe or complicated urinary infections, and shigellosis due to susceptible organisms. See inside the tape cassette holder for complete product information.
Today, sleep is objectively studied through the instrumentation of the sleep laboratory. And today, only one sleep medication objectively fulfills the most important criteria of hypnotic therapy. Dalmane, flurazepam hydrochloride Roche. In sleep laboratory studies, Dalmane proved objectively effective from the beginning of therapy. Dalmane significantly reduced time required to fall asleep and total wake time on the first 3 nights. And by nights 12 through 14, Dalmane continued to significantly reduce both sleep latency and total wake time. Rebound insomnia did not occur when Dalmane therapy was discontinued, and the incidence of morning hangover was low. Patients should be cautioned about driving or drinking alcohol while on therapy, contraindicated during pregnancy. Because the risk of adverse reactions increases with higher doses in the elderly, the dose should be limited to 15 milligrams in these patients. See inside the tape cassette holder for complete product information. For relieving insomnia, the weight of objective evidence supports Dalmane.
No muscle uses its power in pushing, but always in drawing to itself the parts that are joined together. So wrote Leonardo da Vinci in his brilliant observations of muscle action. The power of the muscles serves the body well until the action becomes excessive. Muscle spasm, runaway impulses that rapidly respond to the distinctive muscle relaxant properties of Valium, diazepam, Roche. Inflammation due to local pathology may cause a continuum of spasm, pain, spasm. Valium interrupts this chain of distressing symptoms by selectively inhibiting neuromuscular impulse conduction. Patients taking Valium, a Schedule IV substance, should be cautioned against activities requiring complete mental alertness. Alcohol and other CNS depressants should be avoided. Complete prescribing information is inside the cassette case. When the dynamics of the muscle become the mechanics of spasm, Valium,
the only benzodiazepine indicated as an adjunct in muscle relaxant therapy.